Well, hey guys, what's going on? Welcome to the Michigan Family Wellness Podcast, live from Michigan Family Wellness Clinic. Today we're talking with Doctor of Physical Therapy, Ryan Tisdale. Thanks so much, Ryan, for coming on the podcast.
Oh, thanks for having me. Excited
Awesome.
to be here, Kyle.
Beautiful day. We couldn't have picked a better Michigan day here to
Really should have shot
everything.
outside like
Exactly.
we were saying.
Yes,
we got all our lights and cameras set up though.
Exactly.
So.
Exactly. Well, hey, tell us a little bit more about Kinesis and your background as a doc of physical therapy.
Yeah, so Kinesis PT and Performance is a unique place because we get to work one-on-one with our patients for the entire hour of the session. We really focus on the running community in particular and trying to correct their running mechanics, how they move, and just allow them to be able to run pain-free. A lot of times in physical therapy, I think people get caught up in the fine details and they have a hard time seeing the entire picture. You know, the saying, what is it? You can't see the forest through the trees, or something along those lines. But they'll get hung up at looking at an ankle joint or a knee or a hip instead of looking at the runner as a whole movement system and specifically how they run. So at Kinesis, that's what we get to do. We take a look at the entire movement system, how runners move, and specifically how do they run and how is that interacting with what symptoms they may be presenting with. So,
brilliant. I can't wait to get more into the meat and potatoes of that conversation. Just brief context for our listeners here as well. We had met through the Plymouth Canton Wellness Coalition, which I highly recommend to people out there. If you're a provider, if you're a wellness practitioner, if you're a body worker, a physical therapist, chiropractor, whoever, big plug for the Plymouth Canton Wellness Coalition. If you're in the Novi area where Kinesis and Ryan and his wife Kayleen are, or if you're in Plymouth, Canton, Northville, the surrounding Southeast Michigan area here, we'd love to have you. So just quick plug for the PCWC there. And yeah, let's go ahead and get into it, Ryan. Briefly, I will say, you know, a lot of people know us as just a family wellness practice, but yeah, you know, mothers, fathers, your everyday adult is dabbling with running, getting into running, doing half marathons, doing marathons. So we do see a lot of runners. That's not like a backbone or a foundation of our practice, if you will, but I do love working with runners and helping people out, you know, running more efficiently, running more effectively, and just using the spinal chiropractic adjustment as a collaborative therapy with a lot of what you're doing, with a lot of what Kayleen's doing over there at Kinesis, to help people run more pain-free, more efficient, and more effective. So
absolutely. Well, I think you hit the nail on the head. It is something that so many people do because it's accessible and it's a great form to exercise. I mean, there's not really a huge barrier to entry in terms of cost. Really, if you can find some tennis shoes, or if you prescribe to the barefoot running philosophy, you don't even necessarily need shoes to get in. So we see so many different Americans kind of jump into running for that reason.
Yeah, so there's so many different ways to get into this conversation with you here. Let's just dovetail off that. Tell us more about, you know, what you see people do in terms of getting into running, you know, common mistakes. We talk about importance of movement quality in life.
Yeah.
Everything and anything there.
Yeah, I think that's it right there. Unfortunately, I see most people when they get into running, they don't really take an approach. They just kind of wake up and go, you know what, I think I'm going to take up running today. I'm going to go buy some good shoes, and those good shoes by themselves are going to prevent injury because that's what the running shoe stores say. And that's not to say that shoes aren't important. They are. But that's also kind of I don't know what the word is, kind of brash or a little bit risque way to jump into running, especially let's say you're a desk jockey who works at a desk for 40 to 50 hours a week and you haven't been doing anything and you're just going to go out and pound the pavement for 3 miles, 7 miles, whatever. There's definitely good programs you can follow out there. Some people do the Couch to 5K, but even doing those programs, they don't necessarily address the actually underlying movement or technique of running. So I always encourage people to start off with looking into either pose method is what we use pretty commonly at Kinesis. We're also familiar with Chi. I know that's something you had mentioned, Dr. Kyle, as a methodology and a technique to running, because it is absolutely a skill. And if you are not a skilled runner, typically end up seeing people like ourselves and having similar conversations. So without me talking more about pose, do you want to kind of talk about chi running a little bit and just the basics? Because from what I understand, there's a lot of overlap. So.
Okay. Yeah, and I would say I'm less familiar with pose, but to your point, I'm vaguely familiar with chi running in the sense that they really prescribe, or they really recommend trying to get people to run efficiently and effective. You know, these terms like running economy, which I think we'll talk about a little bit later. It's this whole idea of trying to run pain-free. So I hear a lot of people talk about how running is often just a series of one-legged stances just in succession, and you're kind of just leaning forward there from your ankles, and you're trying to have gravity pull you forward and really leverage the force of gravity to your advantage, so that you're not trying to have to work so hard to run aerobically and just use a ton of energy and make it more of like an anaerobic type thing, and just waste energy everywhere, which can also prevent a lot of injuries as well. You know, I'm sure you'll talk about the ground reactive forces, but it's like, man, if every step that we take has way too high of an impact on our kinematic chain. Love that name there, by the way, with your practice, kinesis.
Thank you.
We're going to have injury, we're going to have breakdown wherever that breakdown happens to be in the kinematic chain, whether it's the ankle, knee, hips, spine, pelvis, you name it. And so I think chi running, you know, Danny Dreyer is the author and kind of creator of that. Been around for a long time. I think he's got a lot of really good methodology and techniques, especially for learning how to run slowly. You know, that whole adage, or thinking of like, okay, you crawl before you walk before you run. I think Danny does a good job at really distilling it down, making it super simple, and almost starting with walking. Like, you know, let's try and have you be an efficient walker, and really focus on getting your cross crawl reflexes going well, using your arms when you run. You know, I laugh with that thought, because right now my daughter, I'll watch her run and she's like all legs. I'm trying to get her to use her arms more to actually run more biomechanically sound. And so she's working on it, but it's a work in progress there. But even with that, if someone's having a difficulty, you know, whether they're just a beginner or whether they're having low back pain like we're talking about here today, or whether they're even a seasoned athlete and they're really into the high endurance, the long distances, halves, fulls, even the ultras, or even the Ironman triathletes type stuff, you know, you can really benefit a lot from slowing things down, running really slow really well, or even walking really well, and then translating that into, or scaling that, if you want to use more of a business term, scaling that into more of that 180 cadence, you know, steps per minute, stuff like that. So yeah, did you want to talk more about pose then, or kind of some overlaps with that?
Well, yeah, absolutely. I think you mentioned building off that and having a foundation, especially even the higher level athletes. Let's say you're somebody who is a seasoned runner, but you're looking to improve your performance or decrease the rate of injuries or risk of injuries. Looking into and applying these different methodologies can be a great way to do that. And like you said with Chi, Pose talks about the same ideas in terms of the correct running posture. So making sure we have the correct alignment through our hips, our shoulders, our spine, our pelvis is in the right position, making sure our contact with the ground is underneath of us, so that we're not actually losing kinetic energy on every step. We're actually using gravity to our advantage, leveraging gravity, so that the elastic properties of your ankle, foot, your lower leg, as they contact the ground, can actually propel us forwards instead of have us fall backwards. When our foot lands out in front of us, if you've heard the term overstride, that's where we get those increased ground reaction forces coming back up the chain. That's where you start to see too much pressure getting put on the ankle, foot. The knee is specifically, I see that a lot in our clinic, and it can translate all the way up to the low back too. Dr. Kyle talked about the running cadence, so that 180 steps per minute, and being skilled at running slow. That's something that Pose talks about. If you're running under that 180, you're going to be in what we call an overstride, right? So again, overstride meaning you're hitting out in front of your center of gravity, and you're basically going to be fighting gravity on every step of your running stride. So both chi and pose, they prescribe or promote that higher cadence. Chi's like 170 to 180, pose is saying 180 plus. So I always say when you hear different people saying similar things, that's something to take note of. So again, learning how to maximize your running posture or alignment, how to utilize gravity to your advantage, meaning your foot contact with the ground, and also how to utilize the elastic principles or elastic properties rather, the musculotendinous junctions, and rather than hanging out on the passive structures of the joints and ligaments are essential to running efficiently and running safely. But like we said, there's a reason why it's an Olympic sport, right? It takes a high degree of skill and technique. So we kind of danced around the topic of injuries, and specifically we're talking about low back pain and how it relates to runners today. Do you mind kind of diving in and saying what you see with some of your people that come in here? If they're runners, what are some of the common deficiencies or impairments you see amongst them?
Excellent question. So it's very basic for my practice. Again, just working with your everyday adult population, people who are just trying to get outside if it's nice out, and just trying to put some miles under their feet. Like you had mentioned earlier, Ryan, oftentimes there is a selection of footwear that's not the best for them. They're overstriding. Their cadence or their steps per minute, or however you want to think of it, steps per second, is not quite right. And their leaning or their kinematics, their biomechanics are not quite right either. And so something I love about how we're designed as the human body and created is such that our foot and the position of our head, everything from the foot to the head, everything in between is really designed towards this forward lean, this very easy and efficient posture of running, or like I said earlier, that series of one-legged stances. So learning how to do this properly and right, or taking someone that does have low back pain, it's really almost deconstructing and going back to those simple basics, and then from there building upon that, identifying misalignments, identifying structural tension, identifying maybe it's a cue that they need, a sensory cue, more of a mental cue, a coaching cue, that can really just be all the difference in the world for helping their running to be more effective. I know we were talking about, let's just take the pelvis, for example. I almost feel hypocritical here. We're sitting, we're in that flexed hip position here. But man, having those psoas muscles lengthened and released can make such a difference if someone's got that anterior tilt posture with their pelvis here. Let's see if I can just demonstrate that a little bit here on the spine without knocking it over.
It's all right.
So yeah, if they've got a pelvis with some really tight hip flexors here coming off, again, that's the front of the lumbar spine. Not a lot of people think about that. They think, doc, it hurts back here. Why are we doing stuff up here? So I try to help people understand you've got these huge two big cables, the psoas, the iliopsoas, even the iliacus here coming off of the bowl of the ilium. And just simple, I'm not even talking about chiropractic adjustments yet, just simple muscle work can make such a huge difference, because again, the goal with running is to have hip extension. If you don't have hip extension, then you're not going anywhere. Right? So it's like, yeah, you can have these awesome glutes, you can do great glute exercises and hip exercises for the glutes and everything, nothing against that. But man, if those hip flexors, if that iliopsoas is just too tight, that is going to bring that pelvis forward, and that is going to make a more challenging context for you to run longer distances for sure with that. I think another thing I hear about, Ryan, is especially living in Michigan, we'll have lots of months of the year where it's just cold and it's just hard to run outside. So people go to the gym and they get on their treadmill, and they just kind of pound the treadmill for quite a while. And I think a lot of injuries can come from that too. I think we have to remember as well. It's a repetitive movement. It's a repetitive movement pattern. So if you're going to do something like 1,000 times, you want to make sure you can do it properly if you're going to add that kind of volume, right?
Absolutely.
Or even like with strength training, if you're working on your bench press or if you're working on your deadlift, it's like, can you do one really good before you start doing 5 sets of 5, and then more than that.
Couldn't agree more.
Yeah, so same idea or same concept. It's like, okay, can we run really well, like we talked about earlier, slowly? But I would even say, this just came to my mind as I was thinking about the treadmill idea, which I think we'll talk a little bit more about tools and techniques later. But the whole idea of, if you can, and nothing against the treadmill. Treadmill is fine, but if you can slightly angle that treadmill up, like on a 1 or a 2 incline, depending on your preference. I'm not talking like a 7 or 8.
Sure.
Just a slight incline there. That can and this is more of a flat, just standard treadmill. That can really help you keep your foot strike, when you talk about the ground reactive forces, more so on that midfoot or forefoot, and really keep you off your heels, regardless of what shoe you're wearing.
Exactly.
I do recommend more of a minimalist shoe. If people like the Vibrams and the 5 fingers, I'm sure you're with me on this as well. You got to acclimate properly to those kinds of footwear. But I would definitely endorse the more minimalist footwear out there that's going to have more of that zero drop. That's kind of a buzz term amongst the shoe community out there. I know Zero shoes are really well to, just drop a few brand names. New Balance has a lot of good stuff. Brooks is really good. Hoka's are excellent. The other thing too that comes to mind, I know I'm going just tangents here, tangents on tangents.
That's all right.
These phones these days are incredible. We were talking about that earlier, and they have the slow motion mode. So even if you can get a buddy, or if you have a small tripod, or just lean it up against a coffee mug or something, put your phone down, on your driveway or your treadmill or whatever, do a slow motion video of your running gait, and then watch that back, look at yourself in the same way that a golfer would, record their swing.
Yeah, absolutely.
So, I think there's just tremendous benefit that can come from utilizing your phone, with that slow motion feature, to just see, like, okay, am I really, slamming my heel into the ground? How is my cadence? How do my muscles look as I'm running? Can I actually see tightness, or can I see that anterior pelvic tilt?
Absolutely.
I'm sure you recommend people do that.
Absolutely. That's actually one of the things we do with every runner that comes into our clinic. We do a running gait analysis, and that's exactly what we look at. We do a frontal plane, meaning we watch them from behind to see if we see any pelvic drop or adduction, internal rotation of the femur, meaning the knees kind of diving in towards each other. How much pronation do we see happening at the foot? Pronation gets demonized, I think, by a lot of people. It's fine if it's controlled. It becomes a problem if we get stuck in this point of pronation. We don't resupinate through the gait cycle.
Yeah.
And it drives the kinematic chain with it.
Sure.
So this is.
I was going to say, help us define pronation.
Yeah. So for those of you who aren't familiar with pronation and supination, or even if I'm looking at the foot right here, just to get you oriented, this is a right foot. This is our tibia, so our shin bone. Here's our heel. So as somebody strikes the ground in a normal walking gait, it should be with the calcaneus first. As they roll through, what starts to happen is pronation through the midfoot. So you'll see these tarsal bones start to go down towards the ground. And as they go into toe off, there's this beautiful thing called a metatarsal break here. As you roll through your toes, that causes the foot to start to resupinate, creating a rigid lever to push off of. In running, because we shouldn't really be hitting with our heel out in front of us, as we talked about before, we're not actually harnessing the elastic properties of our musculotendinous junctions. We're losing all the energy that gravity could be giving us when we do that. We should be landing in more of a midfoot or forefoot strike, assuming that is underneath our center of gravity or underneath our hips. So what you'll see people do is they'll start to pronate, but if they pronate so much that the tibia and the fibula get stuck in a state of internal rotation, meaning your knee starts to get oriented inwards, your femur, your thigh bone starts to turn in, the pelvis can also drop. And as somebody who looks at runners quite frequently, that is a very common cause of a host of origins. I have adopted a saying from one of my professors in PT school, the tissue is not the issue. So as you described with the low back, somebody comes in with low back pain, but really the issue's up front with the psoas muscles. The tissue being the low back, being irritated, the facet joints, or perhaps the nerve roots, whatever's going on back there. We have to address what is actually causing that irritation. Yeah. So that's something in runners we see, and like I said, we take a look at running mechanics and gait. If you don't mind, I want to back up because I love what you said about the treadmill in terms of putting it at an incline, because that's something we recommend, and I think a lot of runners, if they do it, they don't necessarily know why or understand why, and I like that you touched on it helps with the correct contact of your foot. Absolutely. If you ever ran up a hill, try heel striking while you run up a hill.
Right.
It's ultimately impossible. So what it forces you to do is actually be able to lean into the treadmill, very similar to what we'd want to be doing outside if we're running. So the difference in between a treadmill and running on flat ground outside is the belt's moving. All I got to do is pick my feet up to keep up with it. Right. Versus outside, we have to create some of that forward momentum through an interaction with gravity. So we talk about power output, anaerobic, aerobic, all this other stuff, but a lot of times kinesiologists of all types, whether chiropractors, PTs, strength conditioning coaches, you name it, we disregard the fact that we live and move in a gravitational field. And even though a treadmill is a great way to keep running through the winter, it is artificial because we get to almost create that movement without having to fall into gravity or to utilize gravity for that forward propulsion. So doing something by inclining the treadmill, like you said, 1, 2, 3 degrees, nothing very high, that minimal of an incline can help runners actually start to lean into the treadmill a little bit more, similar to what you'd want to be doing when you're outside running off the treadmill.
Brilliant.
Yeah.
Yeah, that section there, Ryan, was excellent. I think there was just so much in there that even I want to go back and watch that. The way you're moving the foot there was just really cool. Of course, I kind of geek out about this stuff too.
Right.
But, so many things there. I talk about backing up and everything. Could just talk about this for quite a while. But one thing that comes to mind to help people get an idea of how that lean feels, what I've heard of before, and I believe this comes from Dr. Mark Cucuzzella, who we actually interviewed on the Michigan Family Wellness podcast here. So if you scroll back through the podcast catalog, you can check out Dr. Mark Cucuzzella. He's great friends with Danny Dreyer and a lot of these pose people. Yeah. And he's a guy out in Shepherdstown, West Virginia, has his own barefoot running store, does the Air Force Marathon every year. Great doc, great runner, fantastic barefoot runner. So if you just want inspiration, like visualization help with running properly with good form, check out some of Dr. Mark's videos up
he's
there.
Got great content for places to start.
Inspirational, I would put it, that high is pretty much how I would think about it. But one thing he'll talk about is if you can just stand in front of a wall, basically have your toes touch the wall. You're standing upright, good posture. I'm sure you do this with your patients too, Ryan. And maybe even just step back like half an inch or maybe an inch. But what you're trying to do with this is you're trying to just lean forward from the ankles. So you're keeping your hips pretty much in line and steady. But you're trying to lean forward from the ankle here so that you get that little bit of ankle flexion. And then you can almost touch the wall with your hands or just catch yourself that far because really that's all you need in terms of that forward motion. That you'll feel gravity start to pull you forward, and then really, that's it. You can get a nice cadence just from that nice lean. Absolutely. And something that Dr. Mark will talk about and Danny Dreyer is in terms of that is running in a nutshell. Now, if you want to run faster, all you do it's like gears on your bicycle. Okay, so if you want to pedal faster or if you want to go faster on your bicycle, well, what do? Well, you go up a gear. You you increase the gear to go faster. So with running, they'll talk about how your forward lean, metaphorically speaking, is your gears on your bicycle. So if you want to run faster, you just lean forward more. You keep everything else the same. You know, yeah, your stride might increase a little bit, you know, but starting with that shorter stride is going to help you decrease those ground reaction forces, keep your pelvis over your feet there. But then, yeah, once you start to lean forward even more, you're gonna increase that stride length. You're just gonna run faster. It's gonna feel effortless. And I would say this from my own personal experience, Ryan. You might get to a point, at least if you're like me at all, it's like your legs are going so fast, you're feeling so good, and now your heart can't keep up. As I hit the microphone. Your heart can't keep up with your body because your heart's not that conditioned, and you're like out of breath, even though you feel euphoric because you get that runner's high. You're like, oh, this feels so good. But now my lungs and my heart, it's more of a cardiovascular, cardiometabolic thing, and less of a musculoskeletal thing. I know that's another tangent, but thoughts on that?
No,
does that elicit?
Yeah, absolutely. That's actually the way he describes it in terms of the lean. That's very similar to what we teach our clients when they come in, when we run some of our running technique courses. I always describe to people the iconic Michael Jackson Smooth Criminal music video. So if you're familiar with it, you'll get what I'm saying. But essentially, Michael Jackson locks his shoes in on stage, but you can't see that. And he does this crazy forward lean. So he's got a straight line from his hips down to his ankles, meaning it's just a straight line all the way through. And what was amazing about that is because he defies gravity, right? And he pulls himself back up. Now, without those special shoes that locked into the stage, that wouldn't be possible. So I describe that to people so they can get an idea of what I'm talking about, what that lean should look like. And then I ask them to just very slowly do that while they're standing in place. I don't put a wall in front of them because what I want them to feel is as they start to do that, they have to step out in front of themselves to essentially catch themselves. So understand that gravity can actually take you forward without zero muscular effort of your own. It's just allowing yourself to go forward with that fall or forward lean. That's something I think takes a high degree of skill, hence why you see athletes or Olympic sprinters at the highest level. They're very good at doing that. It takes a very high level of neuromuscular control and drive to be able to pick your feet up and put them down at the perfect time to be able to maintain that type of lean. And for any of you that are fans of track and field, I'm sure you've seen sprinters as they're crossing the line. Some people think it's a dive at the end, but they're actually falling. They're falling forwards because they are leaning so hard or falling with such an aggressive angle. Sometimes their feet can't catch up. I've actually experienced that as a track athlete myself, and it's a weird phenomenon to feel yourself fall over the front of your feet onto your belly, but it happens when you're running that way. So as I said before, when you hear multiple people and experts, especially from different backgrounds, different approaches, saying very similar things, that's something to take note of, and something both Chi and Pose have in common, and very crucial to increasing performance, but also reducing the risk of injury and incidence of it. So we're supposed to be talking about back pain. I know we're going on tangents here. Why don't we circle back and try to take that back into how does this relate to back pain? What do we see in runners with our back pain, and what do we do to help them out?
Yeah, so we talked about hypertonic psoas muscles. We talked about that anterior pelvic tilt. We can talk about everything from, again, keeping in theme with that musculoskeletal perspective. You can have your external hip rotators, your piriformis, all of your obturators not firing properly. So for everyone who may not know, the piriformis and obturators and external hip rotators are going to be all on the back of the hip there. So tension, even this is where piriformis can come in, sciatica type presentations, which can be involved with low back. You can have everything from issues going on with the feet. You can have a subluxated foot. You can have tension in that mortise joint right here. That's one thing I love doing as a chiropractor, is not only am I looking at the integrity of the vertebral system, but we're also looking at the integrity of the foot. We're doing foot adjustments on people. We're making sure that they have good alignment in all of these joints. 28 bones in the foot, Ryan. It's like if any of these is not properly aligned or moving well, lack of motion, I would say, is more of the clinical indication, then you're not going to have good kinematics there with your stride, with your running. Other things that come to mind, I think about, even from a clinical perspective, the anatomy trained. So not just like individual muscles like psoas and piriformis and quads and that sort of thing, but how are these all linked together throughout the entire lower extremity and even throughout the entire body. So you'll see a lot of deep front line tension. You'll see a lot of spiral line tension. You'll see a lot of lateral line tension with a lot of that iliotibial band syndrome that can creep up into the low back. But by far, my favorite thing to do is to adjust the spine, get really good motion going in those facet joints, which we talked about earlier, those facet joints, to make sure that we got good rotation. Because one thing that does come to mind now that you bring it up is that, and Danny Dreyer will talk about this in Chi running, he'll say that yes, you do get hip extension, okay, in the pelvis, but that's not the extent. Like that extension can actually translate up into the lumbars as well, and even all the way up into the thoracolumbar junction, that T12L1 area. And I'm big on that as a chiropractor because so many people are locked up right here because there is actually a change in the facet planes at that junction, just like there's a change in the facet planes at the junction of the cervical thoracic. So why do I mention this? Because if you are locked up or if you're subluxated in that junctional area, you are not going to be, I don't care how great your hip extension is, you are not going to be able to get that extra drive forward or posterior with your hips there if you can't have good translation of that extension up into your lumbars and your TL junction. So making sure you have good movement there. And again, that can be a result of a lot of that forward flexed posture. If you're a desk jockey working from home all day, at the computer, at the desk, just sitting all the time, it's very easy to get locked up and subluxated right here. So I think it is just super imperative to make sure you have good motion there so that you can get that nice push off and feel that go kind of all the way up into your lower part of your mid back, really. And it's just, again, it's gonna be a game changer for your running, for your gait, for your stride. It's going to feel so much more effective, and really makes a lot of all the strength, all of the exercises and the rehab things that you're doing with people even much more effective as well.
Absolutely. Yeah. And one thing I want to reiterate for people, I hear it, I hope you're hearing it as well, is Dr. Kyle, myself, we approach this. The human form is a movement system. It's not one joint that all works together from the ankle, foot, all the way up through the spine. If something is not working correctly, it can inhibit your movement, or if you're not moving properly, it can result in injuries either above or below within the kinematic chain. So if you're working with a professional who's hyper-focused on one area and you've been hyper-focused on one area of that part of your body, let's say it's low back pain, and you haven't sought out what's going on my ankle foot, what's going on at my hips, what's going on at my TL junction, do I have the rotation, do I have the extensibility through my pecs to allow myself to rotate, how does my running mechanics look? Look for other people out there. There's a lot of people out there who talk similar ways as we do in terms of how they view the body. And this is something I think that's really important and starting to become more prevalent within, I'd say, the medical community. I think for a long time it was kind of focusing on one joint, but it's great to work with a professional like Dr. Kyle who gets it. Like it's fun to talk shit.
Yeah, likewise. So. I feel the same way in terms of the symbiotic nature of kind of what you guys are doing with kinesis. Just as you're talking, it makes me think of the longevity of running, the sustainability of running. As I'm sure you know, if you have a running client, running patient, and you're like, hey, I want you to not run for a few days, they're like, wait, what do you, like, you don't understand. Right, so my point with this brief comment would be, runners want to run for years, for the next 5 years, 10 years. So that longevity, that sustainability, what we're talking about here today can really cater towards that longevity, that sustainability of running. highs, if you will, or, periods of interest in your life where you're like, yeah, this is super cool, this is great. I kind of have that runner's, kind of bent right now. And then, because it is such a repetitive motion, you end up getting injured, which it's probably, I don't have the stats on this, but it's probably one of the activities or sports that just has the highest rates of injury because it is such a repetitive thing.
Yeah.
And what we're talking about is trying to not only recover from injury, but prevent injury from happening even in the first place. So again, work with some really good doctors of physical therapy, some exercise physiologists, kinesiologists. What is Kayleen's preferred nomenclature for her? Right, because she doesn't like the whole personal trainer thing.
Yeah, it's easiest to describe as personal training. I think the reason why she prefers not to go by that is because the profession has been cheapened by a lot of, and no offense to you Instagram stars, but by a lot of Instagram stars who have weekend certification and not really a sound foundational understanding of kinesiology and human movement. It's a lot more than just trying to build muscles for a bodybuilding competition. It's trying to enhance the quality of life for people by enhancing how they move. So as Dr. Kyle is talking about running for life, that's something we try to do with our clients. We want them to be able to do the things they enjoy doing, and which is, for most of them, is running over the course of their life, not just for a couple of years of this time where they really want to be into it and then they get hurt and can't do it anymore.
Yeah.
So
great book that comes to mind, by the way. You talk about running for your life. Dr. Mark has a book called Run for Your Life. Great book, so highly recommend that. Tell us more about McKenzie Extension, Ryan, and how you utilize that in your practice.
Yeah, so McKenzie Extension is typically something I use with acute onset back pain, especially if they're coming in and they have some recent onset radicular stuff. So for those of you who are not familiar with it, McKenzie Extension Principle, it was actually formed by a guy, last name McKenzie, who accidentally put a patient in the wrong position. Are you familiar with this
I don't think
story?
I've heard this story. No.
Okay, so here we go. Yeah, it's really interesting. So the old school of thought used to be flexion, 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 meaning if we're looking at the spine, we have our patient laying on their back. Flexion would be like curling up. Extension, if they're laying on their stomach, would be bending back. The old school of thought was just flexion exercises over and over and over again if we have a patient with low back pain. So he asked the patient to lie on the table, and assuming they would lie on their back, not telling them which way to lie, he had the table already propped into an extension position. So he walks out of the room and he comes back in, the patient's laying there in this super extended position. And he goes, oh my gosh, you're not supposed to be laying that way. Has him get off. Well, the guy gets off the table, he doesn't have pain anymore. So it started this process of trying to figure out what happened and why it happened. So again, when people come into the clinic, there's a few different ways you can go about it. I am not MDT certified or certified in McKenzie, so it is something I dabble in and use. But we'll typically start with something like a prone press up. And the idea is to basically be able to refine or reestablish some of that extension that may have been lost through the lumbar facet joints here. And it's just a real simple press, almost like a cobra, if you're familiar with yoga, or if you're really bad at push-ups and you can't get your belly off the floor when you do a push-up. And we kind of push up into that range just until there's a little bit of discomfort. I always make sure there's no radicular symptoms going down the leg. What we're looking for is a phenomenon called centralization, meaning symptoms are going to where the origin is versus peripheralization as they go down the leg. That's something we don't want, and you as a chiropractor, I'm sure, cringe at.
Love the shop talk, by the way.
Yeah, absolutely.
Awesome. So that's super simple, super easy for people to do at home. Like you said, just kind of that, almost like that cobra. I use McKenzie Extension just for everyday spinal discogenic spondylosis, discogenic just disc problems, really, anything disc related, whether it be a herniation or everything related to the disc. Is McKenzie Extension is just great for that. And I just almost tell people, or have you heard of the Sphinx posture? Does that ever?
Same thing.
So like a Sphinx posture where you're almost kind of like on your elbows coming up into that Egyptian Sphinx pose there, if you will, for just some great Mackenzie extension there. So yeah, simple stuff like that. You talk about taking your shoes off, just going for a walk, another simple, easy drill.
Yeah.
Things like that are just fantastic. Walking barefoot. Again, we talk about how there's such density of neurotransmitters and not neurotransmitters, proprioceptors in the feet.
I knew what you meant.
Yeah, such a density of proprioceptors in the feet. So this is kind of, to drop more shop talk on you guys. If you've seen the homunculus, if you've seen that visual diagram of your brain relative to the density of sensory receptors in your hands and feet, your foot is one of the highest places that you have here. And just going for that barefoot walk can be such a retraining thing for your gait, for your stride. I believe it's Dr. Mark who talks about this. He says, run in a way, let's say your kid, chases their ball out in the street and you see a car coming and you want to go catch your child before they get hit by the car. He says, and you've got your shoes off, you're barefoot, okay? He says, run in a way where you would go and get your kid and prevent them from being hit by the car. Well, I can tell you right now, you're not going to be heel striking if you're barefoot, and you're not going to be slamming your heel into your ground and overstriding and things like that, because you will be forced to have a more natural stride, shorter stride, and it's gonna and you'll be more on your toes and ball of your foot, especially for sprinting. So
aggressive and purposeful.
Yes.
Absolutely.
Yes.
So kind of building off the self-help techniques, the Mackenzie stuff, another thing I know I typically give people to do, because a lot of runners, if they're running longer distances, not as fast, they tend to lack hip range of motion. So we talk about hip extension, hip flexion. So something I almost always give runners when they come in with some low back pain is some hip mobility exercises, because if your hips don't move, your back's going to have to move excessively. Okay. Again, we talk about movement systems and how they're interdependent on one another. So if you have to bend over or squat down to get something off the floor and your hips don't have enough ability to do that, you're still going to get down to the floor. It's just going to come from somewhere else, whether it's your knees or your back. It's typically one of the segments immediately above or below. So that's something else we talk about for those of you who are familiar with it. Pigeon pose I like a lot for yoga. Lizard, like a lizard pose. There's some other ones that we've kind of created and developed. One that we stole from the Posture Restoration Institute. It's what we call a 4-point posterior hip stretch. So it's very similar to a pigeon, but instead of dropping back, we actually keep the femur vertical. And the knee is oriented directly under the midline of the body. So it's almost like you use gravity and the pressure on the femur as a posterior force through the posterior capsule of the hip. So it creates essentially a protraction of the pelvis on one side, so you get adduction of the femur, and it works really, really well in terms of getting the posterior glute fibers to loosen up for people who have a hard time. We talked about the importance of the rotation through thoracolumbar junction for people who have a hard time with some of that lumbopelvic movement and thoracopelvic dissociation. That's really huge. So if you're having issues, those are some great places to start for self-help. I guess from here, where else would you like to go? What else do you think we need to touch on?
Well, I would even underscore even what you were saying too. Hip mobility is so important, so imperative. So can't emphasize what you were saying enough. I also like, I'm not sure if you use this a lot, but just even hip transfers. If people have a swivel chair, I'll just try have them think about your knees are windshield wipers. You keep your feet right where they are, and you just try to, almost like flossing your hip joint there. I'm always trying to get better at that myself. My right side is so tight, my left side's not that bad, but just simple things like that. And then that translates into improvement of quality of life, like in other areas, not just running, just everyday movements, whether you're bending down to get something out of the refrigerator or you're, trying to pick up your kid or whatever it might be, you get just systemic life benefit from having better hip mobility, hip flexibility with that. So great point. To your question about kind of what else plays into this, Yeah, we talk about inflammation here. I mean, if you've got just systemic gut problems, if you're not sleeping well, if you're downing, 5, 6 cups of coffee, just to feel like you can get by, man, I'm not even sure if running is the best place to start.
Yeah, I agree.
I would say you've got to really address, mitochondrial function. You've got to address gut inflammation. We talked about earlier how once you put the pieces of the kinematic and biomechanical chain together, and this running thing really clicks for you, mentally at least, you can get to a point where like just your cardio is not quite up to, like, it can't quite keep up with your legs, at least how I experience, or your lungs.
Yeah.
So you've got to kind of think about, how's my nutrition? How is my sleep schedule, my sleep patterns? Versus like, okay, well, I've been binging Netflix or YouTube for the past, couple of years, and I just want to jump off the couch now and start running. It's like, okay, I support that in principle. I want people to be more less sedentary and moving more. However, don't think that you can just in a healthy way start going out and running half marathons and these long distances right away. I think taking some time, acclimating well, working with people like Ryan and Kayleen, and just really dialing in the movement patterns first is a much more efficient, effective, and sustainable way than just trying to, go at it and potentially injure yourself in the process, especially if you're, pounding the treadmill all the time. One note on treadmills, I just want to mention, Ryan, as well. You've probably seen a lot of these things too. Some of these treadmills actually can go into a decline for people. Yeah. And then you got these super cool new treadmills that are actually curved. Yeah. So then you can, like, the true firm runners and stuff like that, where you can really drill. Now, this is for all you advanced people out there, for, people that want all the gear, right? So you can get treadmills and trainers like that, if running outside is too cold, or if it's hard, part of the weather or season or year there for you. Things like that can be really, really effective for you. One thing I love too, tell us more about cross training. Like, so I hear you talk about, like, okay, yeah, I want to get more into running. I want to get better at my running. But I've heard you say things like, okay, well, what else are you doing? Are you only running, or what else do you think people should be doing to complement their running?
Absolutely, yeah. So we've said a lot through this conversation that running is obviously a very repetitive motion. So there's certain muscles that tend to get hypertrophied for that reason. And if all we're doing is running straight forward in a line for miles and miles and thousands of steps, we tend to get the end result of muscular imbalances, meaning there's certain muscles that get overused and other ones that get underused. For example, one area I see as a problem is the tensor fasciae lata, TFL. Yeah, it is a very important muscle. However, in the running cycle, it's working 2 out of the 3 phases. So in stance, or when you're in support, it is functioning as a pelvic stabilizer to prevent hip adduction, because it's a hip abductor. It is also a hip flexor, so as you're pulling your leg off the ground, it's working to flex the hip. The only time that leg is not working is as your foot is descending towards the ground. So these muscles become very dominant. So we talk about TFL, that muscle feeds into your IT band, and if that muscle becomes overly dominant compared to like your glute med, your glute max, external rotation fibers we mentioned before, that's where you start to see some issues with IT band syndrome. You can see FAI, so femoral acetabular impingement, happening at the hip, just because we don't have a proper balance throughout the pelvic stabilizer. So the idea of cross training is really to do other activities that are complementary to help support your running. So when people come into our facility, that's doing exercises specifically for the external rotation and abduction fibers of the glute max, the glute med. It's doing exercises like a medial step down or a controlled single leg squat, so that we're good with lumbopelvic stability and actually using the correct fibers with correct posture, so that when you go out and you run, you can do this without injuring yourself. I also encourage people to find other activities that they enjoy doing, whether it's playing tennis or going for a hike, riding a bike, something that just engages the body and the mind really to move in a different way. I tell people all the time, exercises like diet, running's a great thing. but too much of a good thing can be a bad thing too. So like broccoli's good, chicken's good, but if all you ate was chicken and broccoli and had nothing else, you'd be very deficient of a lot of the nutrients you need. So I think it's important that exercise is treated similar to a diet in terms of you have a wide variety of movements, because the body was designed to do a whole host of things. But in our modern westernized world, we don't do as many things with it as we used to. So
yeah, I second that. Yeah, brilliant. All good stuff. I would love to plug kettlebells. A lot of people know I'm a huge kettlebell fan. Even Dr. Mark will talk about this. And it doesn't have to be heavy kettlebells, but just the way that kettlebells really force your brain and your body to integrate a lot of the chains or the fascial planes in a very specific way that you don't quite get. You know, correct me if I'm wrong about this, Ryan, but I would argue you don't quite get that kind of integration just with like dumbbells or other, you know, standard linear exercises. There is something about the kettlebell that I think is a little unique and very conducive to running, in the sense that when you go and if you do a little bit of work with kettlebells, and I'm not talking about heavy, complicated stuff, just very simple stuff, whether it be just a simple deadlift or some overhead presses or some simple swings, you know, to work on your hip hinge, things like that, and then you go back to your running. You know, I think there's a complement too there with running being very aerobic and being very, you know, just body weight, and then you add a little bit of weight with the kettlebell. So now you have that anabolic, that cardio, that more strength training aspect. You know, you're challenging your brain a different way. You're trying to add a little bit of resistance there. That can really be a nice complement to each other with that. So. Again, for those of you who know how I love kettlebells, I just had to get that in there in terms of the kettlebells. But going back to the tensor fascia lata, you know, with it being this time of year, can I get my pumpkin spice latte with that as well?
Right.
I couldn't resist. So, Ryan, thanks so much for coming on the platform today. You know, we talked a lot about how we can help runners here, the everyday runner, the advanced athlete and everything. I just want to really recommend your services and everything with Kayleen's doing. You know, Ryan is looking for people who need some corrective exercises to help address an ongoing issue or injury. If you're that kind of person, definitely contact Ryan here. We'll get his contact information here and how you can reach out to him. Kayleen's looking for someone who is not presently in pain or have an active injury but wants to be proactive about their health and improve or support their running abilities through programmed exercises, key term there. So Ryan, how can people contact you and Kayleen and get plugged in over there at Kinesis?
Well, I think the best way we can make this work is if we throw some sort of link below this or something on it so that they can get to the website. And once you get there, for new people, I love to hop on the phone with them and have a conversation about what they're looking for, what they need, if they have in fact pain, have they seen a physician, just to make sure we're a good fit. Do I feel like I can help you? And that's pretty much where we go. From there, it's deciding whether or not we need to schedule an evaluation. Like we said, with Kayleen, if you're just somebody who's looking to be more proactive, it's scheduling a movement assessment or a fitness consultation with her. It's a free service, and she takes you through essentially what we do here at Kinesis, and takes a look at what areas you could improve on, and kind of works towards their goals with them. So
awesome.
That's it. Yeah.
Awesome.
Thank you again for having us.
Yeah, not a problem. Great talking with you here today.
Absolutely.
Guys, check out Kinesis. What's your website?
KinesisPTandPerformance.com.
Brilliant. So guys, check that out. Again, MichiganFamilyWellness.com for anyone looking for spinal chiropractic adjustments or just really good musculoskeletal support with their running. And with that, we'll talk to you guys soon. We'll talk to you next time. Yeah, so we talked about the anatomy trains. This is what the anatomy trains looks like here. So we're talking about fascial planes that connect large sections of the body together as an entire functional unit. So not just focusing on one area locally of the body, like the neck, for example, the cervical spine. We're looking at the entire superficial back line here, how the entire posterior chain is connected all the way from the top of the head all the way down
through the thoracics and lumbars into the glutes, all the way down the hamstrings, the back of the leg to the foot. So that's what we talk about with different anatomy trains here, how the anatomy is connected into a train-like metaphor, and looking at dysfunction and function from that perspective. Okay, so here are the hip transfers. So basically you just get on the floor here, nice upright posture with one leg out with that 90-90, and then the other leg as well. You're trying to keep as much of your legs on the floor as possible. So I love this for flossing the hips, nice good hip mobility. You can use your hands behind you to help, but what you want to do is basically use your knees. Think of your knees as windshield wipers. So you're trying to keep everything the same here, and you're just shifting your weight from one hip to the other, and you're trying to stay as upright as possible. As you can probably tell, I'm pretty good on this side, and moving over here is the side that I need to work on in terms of keeping all those legs down. So this is a really good hip flossing exercise, excellent for working on hip mobility. So do this every day and have better hips.